Hi, this is Leighton Jin. I'm the Director of Development for the American Documentary and Animation Film Festival. Today we have a very special guest. We're going to call him a distinguished alumni because earlier this week he was announced he won a Peabody Award, and he was at AmDocs. I believe it was his first feature, Deluxe Soup. So we're going to cover all that. But Matthew Hashigouchi, am I pronouncing that right, Matthew?
That's right.
Yeah, we've known each other for over a decade, and I just want to make sure I get your name right.
Mhm.
But Matthew, congratulations. Your film is The One Doctor. Can you talk about your film and how you came across the subject?
Well, it started when my wife and I were preparing for a child, and Georgia at the time was the worst state in the United States for maternal mortality and infant mortality. Its healthcare system is pitiful. So I thought, the best way to prepare for a birth would be to make a film about it. And as I was making it and researching it, I hadn't really even made it. I had interviewed a few people, but I kind of realized that I was not the best person to tell that story. But I had read an interview with Dr. Kinsell where she was talking about um, access to overall health systems in rural places of the state and the country, and how all these aspects can impact health, like playgrounds or grocery stores or uh, pharmacies and just many things that impact health. And she was this one doctor in probably one of the poorest counties in the United States, a very, very isolated rural region in Georgia. And I called her and just talked to her for about an hour and told her what I wanted to do. I wanted to kind of embed myself in a clinic, in a medical setting, and film patients and talk to them and just kind of document what she does from day to day. And she said, sure, as long as patients are okay, you can film whatever you want. And I went down there the beginning of 2019, and I think we finished filming in early 2022, and then we premiered at Hot Docs in 2023. So it was like a four-year process or so, and we're just incredibly honored to, at this point, to receive this Peabody. Totally unexpected, but I'll take the win. It's a incredible honor for me.
Um, when in the process of making this film, what did you learn most, or what surprised you most? I mean, obviously, we all have a general idea. Maybe the healthcare of this country is maybe good, but not what it should be, or we have our own opinions on it. As you started doing this story and exploring it deeper and looking at it more intimately, what do you think surprised you, or that you learned about healthcare in this country?
I think it was really surprising to see how people get by with so little, and especially in this rural county, people don't have um, there was no pharmacy, there was no dentist, there's no high school, there's a grocery store, but it's not a an affordable grocery store because there's such little business that they have to raise the prices. So they don't really have access to affordable or good food. I think most of them shop at the Dollar General for, for their groceries. Um, but they somehow manage to get by with very little options, very little resources. So I think when I was filming, I was impressed and encouraged just by their hope and their resolve. They kind of just tried to figure things out for themselves if they didn't have those resources. Like if they needed to go to a pharmacy, 40 miles away, they would kind of round up a bunch of people and say, this one person has a car, let's all hop in, go to the pharmacy, and we'll get our medicine. Or if they needed to go see a specialist 70 miles away, they would figure out, okay, well, who's going that way? And can I get a ride out to that specialist? So I think it was um, encouraging, but also sad to see how little people had. But then it was incredible just to see that they were figuring out a way to scrape by. Um, but it was in no way an appropriate way to live in the United States. The wealthiest country in the world. It was a shameful situation for a country and embarrassing for a country. And what I dawned on me is that, there are places in our country that are worse than third world countries. There are third world countries that have better healthcare than some of the parts of our country. And it was not a good look for the state of Georgia. It's not a good look for the South. It's not a good look for our healthcare system, and it's not a good look for our country.
With this film, now that's getting a lot more recognition and a bigger platform, what kind of impact have you started to see evolve from this production?
We've had a number of screenings at medical schools, and I think what this film is encouraging people to do is to go into healthcare in rural places and to encourage doctors or nurses or physician assistants to practice in rural places because that is part of the problem. They can't get people to move to these places. And if you want to work in a rural location, you're likely going to be from that rural location. A place like Clay County, lack of education, lack of opportunity, lack of even awareness that, hey, I'm going to go be a doctor. If someone's going to go be a doctor in Clay County after Dr. Kinsell, they're likely going to have to be from Clay County. So what we've been doing is going into medical schools and working with medical organizations to screen the film and to talk about the importance of working in rural regions and to encourage them to think about going into rural regions and to share information with them that if they do go into rural regions, they can have some of their student loan debt forgiven.
Well,
So I think it's been a successful tool to inform up and coming medical practitioners and doctors and nurses that, you don't have to go to Atlanta or New York where you could throw a stone and you'll hit a doctor or a nurse. But in a place like Clay County, Georgia, there's only one doctor within a 50-mile radius, and that your skills and your knowledge would probably be much more valued there than in a place like Atlanta. Um, but a lot of people don't want to live in a rural area or an isolated region. So it's trying to reach those people who want to make a difference through their medical knowledge and trying to encourage them to look into how they can do that.
and her name escapes me, the doctor you focused on. Can you talk to me about your relationship with her and how it grew through this process? I mean, she sounds like a very inspiring person.
She is Dr. Karen Kinsell. She's from a rural region. She's from Indiana. And she grew up in a rural place and she grew up wealthy. She grew up very privileged. Her family was in the agriculture business and they developed some new hybrid corn seed or something like that. So they grew up with wealth. She went to New York because she wanted to work in social work. She was a social worker. And while she was in New York as a social worker, she saw homeless people on the street, something she had never seen before. And she went to Columbia late. She was a late medical student. She graduated and after she graduated, she said, I'm going to look for, the poorest place in the country. And she opened up a almanac or something like that and found Georgia, counties in Georgia that were just high rates of poverty, high rates of illness, and she moved to Georgia just kind of on a whim. And um, eventually she moved to Clay County where there was one doctor at the time, and he passed, and then she became the only doctor. So she's really been the only doctor there for about 20 years. Um, I think something that I found very admirable about her is she's very principled. She has a strong sense of her morals and her values, and she doesn't stray from that. And and she does whatever needs to be done to help patients. So something that has gotten her in trouble in the past is when she worked for these larger medical organizations, she would give patients money out of her own pocket because they couldn't afford medicine, or she would give them money for gas so they can travel to a pharmacy. And that got her fired because the medical systems that she worked for did not approve of that, and it was considered um, I don't know, an ethical issue. So what she does is she just opened up her own practice. So she is her own boss and she calls all the shots and she decides what she can and cannot do. And she decides who can and cannot come into her clinic. Like, for example, I would never have been able to film in a facility that was part of a larger medical organization. It just, they would never allow me in there. But Dr. Kinsell owns her own practice, her own clinic, and she said I can come in. So I'm I really admire her willingness to kind of put her own well-being on the line for the benefit of her patients. And in the film, we kind of focus on that. She doesn't get paid. She's a full-time volunteer, and she is spending her own money keeping the doors open and spending her own money um, paying employees. So she's a full-time volunteer doctor working in one of the poorest places in the country who just will not give up and will do whatever she can do to make sure patients get help. She doesn't charge patients a lot of the time. So, I mean, she's a free source of healthcare, very knowledgeable, experienced, smart doctor who is providing somewhat free medical care in one of the poorest places in the country. And I think that just is something that we need to hold up as uh, a model to emulate in our society.
What about timing of this story? Obviously, there's a lot of things going on in this country. How important do you think it is, the timing of the when this film has come out, and how it's important to tell this story during these times?
Oh yeah, I mean, we were filming a year and then the pandemic hit. So we were filming right when COVID arrived. We took a pause and then we realized, hey, we need to keep filming because they're doing things that are really important to convey, especially in terms of public health, because she's seeing people that can't afford care. When she received the vaccine on Christmas Day, and by the day after Christmas, she was calling people up, providing them the COVID vaccine, and we were filming that. And she's also the highest vaccinated county in the state of Georgia, the highest COVID vaccinated county because of her um, because of her willingness to call people and say, "Do you want this vaccine?" and to also travel to people to give them that vaccine. I mean, that's incredible. She's doing this really on her own. She has some help. She has a nurse, but she's making all those calls herself to ensure that people are vaccinated. So, the COVID moment was sort of bittersweet, but I think it was important to document to show here is this very poor place. Here are these very disadvantaged people, and here's a doctor who's doing whatever she can to make sure they're taken care of. And then I think right now, Trump administration is attacking public institutions and trying to remove, publicly funded programs, not just um, not just in medical scenarios, but also in public media. And I think this film is an example of not just the importance of providing healthcare for people that can't afford it, but also providing media and covering stories for people that are not around news stations or larger, urban areas that have a lot of uh, news stations and newspapers and media covering their stories. So, I mean, I think this film kind of touches on a number of things and reveals a lot of things that our citizens don't have in this country, whether it's medicine or just media coverage and stories that can be shared with, the public.
So I'm glad you brought up the media. So as a background, me and Matthew got to know each other through a convention we attended. We were both part of the Asian American Journalists Association, and that was over 10 years ago, maybe 15, oh, maybe 20, geez. But anyway, that was a long time ago. But it's interesting you point that out because the platform is shrinking for news organizations, and obviously I have a friend. I'm sure you have friends who've been laid off from journalism institutions. In fact, I have another friend who's with Voice of America. And they're struggling, with issues with the administration right now, whether it'll be open or not open. And I'm sure that's affecting coverage. Can you talk? Can you talk about the importance? with the struggles journalism going through, the traditional media sources, there's a lot of downsizing. Where does documentaries fit in that in terms of providing providing a platform and telling these stories? Because obviously that those opportunities are shrinking because staff is shrinking, resources are shrinking. How important does is documentaries in trying to fill that gap that's being created?
I think it's really in-depth, long form storytelling. I think a lot of newspapers and news organizations will touch upon rural health and or rural issues or stories of, underserved and minority populations. But, if you turn on your local news station, they may have like a 2-minute segment on rural health or a 2-minute segment on underserved populations somewhere. What I think something like PBS and NPR and Corporation for Public Broadcasting and what documentary allows us to do is to really tell long, in-depth stories that uncover a lot of layers of these issues rather than just skimming over the top. And I don't think you're going to find that in a lot of media uh, outlets. And that's really where I think documentary thrives, is just really telling complicated stories and looking at many various aspects of it and speaking to many different types of people and incorporating many different types of voices. And and if PBS hadn't supported this in Real South and this story wouldn't have been told. I don't think that it would have uh been able to reach the public in the way that we were able to. And I think people in rural areas, they'll have access to media. They have phones, so they get a lot of their information from Facebook. But I think there's a lot of issues if you're relying upon all your news and your information from Facebook or Twitter. So I think, something like public media, it provides, fact-checked, reliable information, in addition to allowing someone like me or other documentary filmmakers to go in and really spend 5 years, 4 years telling a single story about a single place or a single experience. So yeah, that's where I think the value of documentary is it allows really in-depth storytelling and allows for an arc to take place. I mean, we started in early 2019, finished in 2022. A lot happened within those 3, 4 years. And if we were a local news station, you know, you just wouldn't have that ability to tell a 75-minute story that took place over the span of 4 years. It just wouldn't happen.
Yeah, and those 4 years gives you a real complete perspective on everything she's going through because I'm sure over that time there's a lot of obstacles she had to deal with that you were able to capture. You kind of touched on it, but more specifically, how, and I'm keep forgetting, I'm sorry, I haven't what this does, keep blanking her name. How is she able to fund everything if she's not getting paid? Because that's a remarkable thing that she's doing. But how's she able to keep it going? Because I mean, it's not cheap healthcare. How's she able to provide that care, especially patients who aren't able to pay? And where's that money coming from?
She has a wealthy family and she inherited money and she spends her family's money keeping her clinic open. That's really what it is. The clinic pays some things, and during COVID, they had permitted telehealth. That really
Hmm.
wasn't permitted prior in the way that it is permitted now. And then Medicaid and Medicare uh, were reimbursing for those visits. So when COVID came, it allowed her to see more patients virtually, and that helped pay some bills. But a majority of her funds comes from her family inheritance that she just funnels right into her practice. I mean, she's spending her own money. That it's an incredible privilege, and her model is not replicable anywhere else, and it shouldn't be. Medical care should not rely upon the kindness of a stranger. It should not rely upon a full-time volunteer doctor. She is just in this incredible position where she has resources and she's making the decision to put all her resources into funding healthcare.
We're gonna jump back in time a little bit. Your first time at AmDocs, and you were there for your was it your first film? Good Luck Soup.
That's right, my first feature. Yeah, good luck, suit.
Can you talk about that film and then also your experiences coming out to AmDocs to show it in here in Palm Springs?
Yeah, that was my first feature. It was a story that I had been wanting to tell, or it was a story and experience that I had been wanting to kind of explore, just growing up Japanese American in the Midwest, and how trauma kind of lives through generations, because it focused on my grandmother who was in the internment camps, and then it tells how she relocated to the South and then the Midwest, and then how we all grew up in the Midwest amongst all these, Europeans and kind of white um, Catholic communities, Jewish communities. So that was I think something where I was trying to understand, like, where do I fit in, and how does my grandmother and family members' experiences also kind of mirror mine or not mirror mine. But it was great coming out to, AmDocs and screening this, and Teddy has always been supportive of what I was doing and encouraging, and just to be able to bring it to, AmDocs when he had been aware of it while I was making it was great. It's wonderful when people keep track of your work, and then when you're ready to share it, they say, "Hey, come share this with an audience." It's also great coming to California, to share this film with a California audience, because our family story starts in California. It starts in LA, starts in Sacramento, and to be able to come back to that state where my family, you know, began in this country was a wonderful experience.
Now you're also a professor at Georgia Southern University. Can you talk about what's what kind of advice do you give students pursuing this career?
I always tell them, don't be afraid to fail. And I always try to share my failures with them, because I was not a good student. I did not succeed in grade school or high school. It wasn't until I reached college that I really thought about a career, or um, a focus of study that I can really kind of devote myself to. And, to get a Peabody Award, I feel like a fraud in a way. Imposter syndrome, I think, is a good way to describe it, because I was just never a studious person, and I have never set out to win anything. So to, win an award when you don't really set out to win something is just kind of a strange feeling that I haven't really, you know, understood yet. So I just want them to realize that, you need to fail, you need to struggle, and you need to figure out how do you then do better and improve and set yourself up for success after those failures.
You know what? You're talking about imposter syndrome, and I was like, I I completely do not see that about you because just talking about your process and pursuing a story, but then pivoting when you find and learn something during your process, and then discovering the story. I think that's what makes you great, and I think that's what makes a lot of documentaries great. Is not only that is able to pivot and service the story as it develops in front of them. And I think that's what makes you great at what you do and what made this such a successful film. So I think the Peabody's well deserved. That's just my little
Thank you. Yeah,
opinion.
adjusting, knowing how to adjust, knowing how to pivot and modify, and recognize when do you do something different. Yeah, that's very
Yeah, because
important.
I've been doing these interviews for the last 2 years, and that's the theme I've had with a lot of the filmmakers is that they've set out to do something and have a certain story in mind, but then as they do it, then they see things are different and they adjust to it because and it brings such a great truth and perspective to it because we go in doing stories, sometimes we have a preconceived notion, but you also have to be open that maybe this preconceived notion is wrong, or there's some elements that are missing that gives you a wrong preconceived notion. And that's what I love about documentaries, and I love you just sharing this story because that's what it's inspiring. I have goosebumps just talking to you about it. uh, I'm going to share another thing. So when we were roommates, it was you, me, and another roommate we had, Brett Okamoto, who works for ESPN, and he's a UFC writer, and he also produced a documentary. And so it was kind of cool that we're in a journalism conference, but then everyone wound up getting involved in documentary filmmaking in one way or another. So I think that was really cool. Now we got to address your shirt, Ron Burgundy University. Can you just explain that to people?
Yeah. When I was at in film school at Emerson College in Boston, and Anchorman 2 had just come out, and Will Ferrell came to Emerson College as Ron Burgundy, and they renamed the school the Ron Burgundy School of Communication, and he was just in character the whole time, interacting with students. And I went to the bookstore and I saw this shirt. I'm like, I need to have this shirt. So this is one of my favorite shirts. And actually, I think Will Ferrell won. They won a Peabody as well for their documentary Will and Harper, I think it's called.
Right.
So I I'm hoping they're going to be at the Peabodys, and I'm going to bring the shirt because I'm going to try to get him to see the shirt and try to have a conversation with him about it. But this is one of my prized possessions. Yeah, I love this shirt.
That is amazing. That is really amazing. I'm so flattered that you wore it for our interview today. I think that's gonna be really awesome. Um, and also, can you tell me you're gonna be in Los Angeles in June to accept the awards? Can you what's the date on that again?
June 1st.
June 1st. Well, congratulations. We're all proud that you're part of our family, and to see you achieve on such a high level brings us all a level of pride. So, Matt, congratulations, and we're all really happy for you and really proud of you.
Thank
And
you, Leighton.
thank you for sharing your time. So, just a reminder, the American Documentary Animation Film Festival, we completed our 14th year. Next year's festival will be March 25th to 29th in Palm Springs, California. If you're a filmmaker, you can submit your films now until the end of the year. You can go to our website, www.amdocfilmfest.com. Again, Matthew, congratulations. We're all proud of you.
Thank you, Leighton.